Food addiction refers to a compulsive and uncontrollable desire to eat despite negative consequences such as weight gain or health problems. It's characterized by a loss of control over food choices and consumption and could lead to a significant distress or impairment in daily life. Some of the most common food addictions are addiction to pizza, chocolate, potato chips, ice cream, French fries, cake, and cheeseburgers. Food addiction is classified as a behavioral addiction, and it's similar to what you would see in someone who is addicted to alcohol or abuses drugs. Has that same effect on the brain. Consuming an excessive amount of food or emotionally coping with their negative emotions and enhanced emotions can cause a significant amount of risk to being addicted to food. So emotional eating tends to occur because when people experience stress, the stress hormone cortisol increase and they're motivated to eat more. So this emotional eating can be one of the side effects of food addiction. Transfer addiction is the act of trading one addiction for another, and it happens when a person who is in recovery begins to substitute one addiction for another, typically during or after treatment for the original addiction. And this is true of bariatric patients. They undergo their treatment, which is surgery, and get treated for their addiction with that surgery, can develop another addiction or trade that off for another addiction, such as gambling, having sex, drinking alcohol, smoking cigarettes, or popping pills. Healthcare providers refer to this trade-off as cross addiction or transfer addiction, process addiction, or habit swapping. The two most alarming psychiatric complications of bariatric surgery are suicide and addiction. So these are the major ones doctors warn about and they observe their patients for, which is typically why most healthcare providers warn their bariatric patients not to consume alcohol because of the risk of transfer addiction. So if you're struggling with transfer addiction, it is important to seek professional help. A therapist or counselor can work with you to identify the underlying causes of addiction and develop strategies for managing your urges. Support groups are available as well and also provide valuable guidance and support. Remember, overcoming addiction takes time and effort, but it is possible with the right help and support.